Medicare open enrollment is underway, and it ends on December 7th. Pay close attention to the dates. Joining me now to tell us more about this is Craig Gusson, the expert, the man who knows, from the San Diego Association of Health Underwriters. Nice to have you here.
Good morning, Carl.
All right, so as you go through this, when you reach age 65, you get a pile of mail from the government that says, hey, guess what? You're eligible for Medicare. Right. So you have plan A, B, C, D, and there's so many things going on here. All right, what's happening right now? What should we be paying attention to?
Anybody who has Medicare today, what they want to pay attention to is the plan they have. Is it working for them? If it is, then you're fine. The biggest thing we find out is prescriptions. Is you're taking a new prescription, and all of a sudden your costs are really expensive for prescriptions. So you might want to go to the government website, look at your prescription, and see if there's other plans that are available to you.
What would that look like on the web page?
You can go in, put in all your information, put in all the prescriptions you take, where you live, and it will pull up a list of all the companies that offer a prescription plan. You can also reach out to your health insurance agent, and they can help you do the same thing and figure out which plan works best. And you can change it every year, and a lot of clients do, just because of prescription needs. You know, when you turn 65, you may say, hey, I have no prescriptions. You find the lowest cost plan out there, and you buy it. Now, people say, why do I need a prescription plan if I'm not taking any? It's because the government penalizes you 1% of the premium for each month you wait before you get a prescription plan. So it's really worth paying $10 or $15 a month to get it.
So what does this window do, this window that's happening right now?
So you have between October 15th and December 7th to look at your Medicare plan, your prescription plan, and decide if you want to make any changes on January 1st.
So the only changes are really that are a primary concern are the prescription issue. But is there anything else there that you should be looking at?
If your plan is changing, if you're seeing some significant benefit changes to your plan, you could change your plan. If you find out that, oh, my doctor doesn't take Medicare anymore, well, then you may want to change your plan, because these plans are all based on it. The doctor takes Medicare, which happens in 95, 98% of the times. So that's really what you want to look at. If you haven't used it much, or if you're planning to have a procedure next year, you want to make sure that the plan you have is in your best interest. And a lot of people go, well, I don't know. And that's what we do as agents. You know, we get paid by the insurance companies, but we take care of you and to make sure that you have the right plan.
I was going to ask you about that, because just navigating this stuff is so complicated. And you know, I went to college. I understand complicated documents, but this stuff really is very confusing. It
is, and we'll spend months and months between August, September, and even in October, looking at all the nuances and all the new plans out there to figure out what's best. And everybody's situation is different. That's why it's really important to work with an expert, work with a health insurance agent who specializes in Medicare and can help you navigate through it and figure out which is best for you. And every year, just do the same thing. A lot of years, you're just going to keep what you have because nothing really changed. Other years, you got a procedure coming up, you got a new prescription, your cost for the prescription plan is going up a lot. You may want to look at some different options to see if you can save money and better your plan.
Craig Gusson, thanks so much for the advice.
Pleasure.
Appreciate that very much, you coming in this morning.